There is an invisible, ticking clock hanging over anyone who has experienced deep emotional pain. It whispers an exhausting demand. You should be over this by now. That pressure is fueled by a few persistent myths. The first is the idea that trauma only counts if it involves a cinematic, life-threatening event. We are often told that if there was no physical catastrophe, there is no reason to still be hurting. Then comes the well-meaning but dangerous advice from friends and family. Time heals all wounds. They suggest that if you just wait it out, the pain will naturally fade away. This timeline shows the biological reality. Human nerves do not operate on a calendar. Untreated emotional trauma does not dissipate with the years. It becomes increasingly tangled and dense, compounding into a heavier burden as time moves forward. The weight you still carry is not a sign of personal weakness. It is the result of a biological wound being forced to follow a passive societal schedule that doesn't actually exist. Emotional and developmental trauma are physical states. They lock the body into a cycle of hypervigilance, where the nervous system remains braced for a threat that has already passed. This physical tension leads to a common fear that bringing up the past will only agitate the pain, making the symptoms worse than they are now. In a trauma-informed environment, targeted processing allows those rigid nodes of tension to finally relax. It provides the physiological cue for the nervous system to finally exhale. This isn't aimless venting. It is a structured clinical approach designed to safely unspool the trauma and recalibrate your brain's threat response. Engaging directly with the source material is the necessary biological trigger that tells your nervous system to stop treating a past memory as an active, present danger. The clinical data proves exactly how well this mechanism works. Trauma is a highly treatable condition when met with the right tools. The American Psychological Association recommends specific first-line treatments for PTSD, including prolonged exposure, cognitive processing therapy, and EMDR. Clinical success is defined by the term remission. This is the point where a patient no longer carries enough symptoms to qualify for a PTSD diagnosis. This chart tracks remission rates. Across targeted modalities, success ranges from 53 to 70%. When you place that success bracket next to the flat line of passive waiting, the evidence is clear. Active treatment creates the change time cannot. This clinical reality has transformed the expected outcomes for survivors, moving the goal from simple coping to total remission. The data suggests that the passage of years is a poor metric for recovery. True progress is tethered to active treatment, not the calendar. Even knowing the science, the barrier to starting can be steep. Many people feel intimidated at the thought of discussing deep trauma face-to-face with a general doctor. This is a private PTSD screener available at chctherapy.com/mentalhealthtests. It offers a low-barrier way to assess your needs from a private screen. The screener serves as a discreet route to care. If the results indicate a need, it connects you directly to specialty care to begin the process. That care is managed by Coping and Healing Counseling, a 100% telehealth practice serving all 159 counties in Georgia with a diverse, culturally competent team. CHC accepts major insurance providers to keep treatment accessible, and for Medicaid patients, the copay is $0. Recovery does not require you to wait for the clock to run out. By taking one private step, you allow your nervous system to begin its true biological journey to healing.